My name is Joshua Wisch. I am the Executive Director of the ACLU of Hawaii, and we want to share with you the importance of what we've been doing and why we need everybody who's listening in as part of this fight. As part of today's discussion, you're going to be hearing from me, ACLU of Hawaii Legal Director, Mateo, ACLU of Hawaii Smart Justice Campaign Director, Monica Espitia. Special thanks, by the way, to Monica for really organizing this event, and thanks also to our communications manager, Kathleen Wong, and our development director, Katie Chavez, for playing key roles in making the webinar possible and also making it run smoothly. This is also one of our first attempts at a webinar like this, so thanks for your indulgence as we're working through some of the tech. We're also going to be hearing from 3 local doctors and public health experts, Dr. Seiji Yamada, Dr. Kealoha Fox, and Dr. Scott Miscovich. They're going to be able to explain from a public health standpoint how critical it is to immediately reduce the population of our jails and prisons to prevent the type of catastrophic COVID outbreak we've seen in some jails on the continent. And we're going to hear from Jamee Miller, someone who is directly impacted by the carceral system as her son is currently in Saguaro. And then we'll have some time for Q&A before we're done. We are going to try to get through all the presentations first because we know that some of our panelists are on pretty tight timetables. As we were getting ready for the webinar, Dr. Fox had actually mentioned that today is World Health Day and it's National Public Health Week. And as she had noted, there's no better time for us to come together for the public health and well-being of all people. Now, before we dive in with our panelists, I just wanted to share a couple thoughts to set some context, thoughts about why it's so important to still be a watchdog for civil rights at times like these, and to provide some information about some of the ways the ACLU of Hawaii has been doing this over the last few weeks. Because it's important to remember that even during a pandemic, the Constitution and its guarantees of liberty are still there. We still have the right to free speech, we still have due process rights, we still have the rights to equal protection under the law. These rights don't just go away. And in just the last few weeks, there have been a number of areas where we've spoken out about things, where we've seen our local and state government take action that we think are wrong from a constitutional standpoint and often wrong from a public health standpoint. So for a few of those, houselessness. Working with allies, including people who are themselves unsheltered, we raised alarms when the city and county of Honolulu said it was going to keep sweeping people who were houseless and said that it would not reopen park bathrooms. This completely violated CDC guidelines and made it impossible for people to practice basic hygiene. Thanks to public pressure from people like you, the city finally backed down, and we're still working to make sure that park bathrooms open throughout the state. I do want to note that Kauai has been a leader in this. Its mayor, Derek Kawakami, had specifically reserved the parks as a safe place for the unsheltered population during the crisis. Transparency. We joined with other allies in an effort led by Common Cause to call on state government to be more transparent. As part of the emergency orders we're currently under, the government made sweeping suspensions of the law, including laws relating to open meetings. That's gone farther than other places, and we've raised alarms about it. In jails and prisons, the primary topic we're focused on today. Our legal director, Mateo, wrote weeks ago to the Public Safety Department asking how they were going to respond to a pandemic within their walls, and has drafted a friend of the court brief supporting the position of the public defenders. Our Smart Justice Campaign Director, Monica, wrote to county police chiefs with guidance on how to enforce laws during this crisis while respecting civil liberties, and how doing things like arresting people and incarcerating them for violation of emergency orders is actually the wrong approach, because it only further crowds our overcrowded jails. Now, many places across the country have actually been following the advice of public health experts and have been proactive in working to release certain incarcerated people like kupuna, people who are pregnant, those with high-risk medical needs, those who are being held pre-trial and haven't actually been convicted, and those who have small amounts of time left on their sentence. And also, it's important to note, this doesn't only protect them, it protects the guards from getting sick, who will then go home and give it to their families and then their larger communities. This is about protecting everyone's health. Unfortunately, 3 out of 4 of our prosecutors have been ignoring the advice of public health experts and opposing releases that would meaningfully reduce the likelihood of a devastating COVID outbreak. They've been unfortunately misinforming people, spreading a false narrative that the public defenders and the ACLU and Lawyers for Equal Justice are just trying to swing open the doors and let everyone out. It's disingenuous, and in light of widely accepted public health advice, it's dangerous. And again, Kauai has been the one exception, as its prosecutor, Justin Kohler, has been following public health advice and advocating for decreasing the jail population during the crisis. All this is to say that crises like these are when it is especially important to watch out for erosions of civil liberties, as we've seen in the response from From everything to Pearl Harbor to 9/11 and more, government is prone, unfortunately, to committing abuses in times of crisis. And while this crisis is different than those, we're still on watch. And we are on watch for when government says absurd things like a jail is the safest place to be right now, which is absolutely wrong according to all public health experts. So with that, let me turn this over to our legal director, Mateo Caballero, who can walk us through some of the work that our legal department, along with the public defenders and lawyers for equal justice, have been doing on this issue in recent days.
Perfect. Aloha, everyone. Thanks for joining the webinar. I'm here to talk about the legal efforts underway in Hawaii to address a potential outbreak in our extremely overcrowded prisons and jails. Before I get started, let me again introduce myself, Mateo Caballero, legal director, and my pronouns are he, him, his. So I want to get a few things out of the way. And there are three common misconceptions, and Josh already touched a little bit on them, but I wanted to just dig a little bit deeper. The first thing is that you might have heard from many people out there saying that, we're letting dangerous people out. That is not the case. The release being contemplated here is for very specific groups of people. Essentially, and I'm gonna go over them, individually, but one of the groups is people who would get out soon in any case. People who were convicted of misdemeanors or on probation serving a jail term. The second group of people is people who were out on probation or parole. So they were deemed safe enough to be out and about, but they went back to jail or prison for technical reasons. Because, for example, they missed a meeting with their parole officer, or they tested positive on a drug test, not because they were convicted of another felon. The third group of people is people detained pre-trial. People essentially that have not been found guilty of whatever crime they're in jail for. And they simply cannot get out because of an amount of cash that was set for bail, which they cannot afford. The fourth group of people is people convicted of certain non-violent felonies. And again, these are people that are serving time, but their felonies are not, they don't involve violence against anyone. And the last one is people at high risk of contracting, at high risk if they contract COVID-19. For example, people who are elderly, pregnant, with heart or lung conditions, diabetes, etc. So that's the first thing that I wanted to clear out. The second thing was, this is not about mass or blanket release. There is going to be exceptions even within for these groups of people if they pose a legitimate risk to someone on the outside. For example, someone with a history of domestic violence against a person. The appointment of a special master allows precisely that type of individualized review for each case to make sure people who pose danger to others, stay in prison and jail. The third misconception that I wanted to address is that our jails and prisons are not full of dangerous people who deserve to be there. Our jails are in fact, yes, full to the brim, but the vast majority of people in jail and prison are there on a conviction for a non-violent crime. Since the 1970s, Hawaii's incarceration rate has exploded, growing as much as 3 to 4 times on a per capita basis. Yet, according to the latest statistics from the AG's office, our crime rate per capita is at historic lows. So what happened? We started arresting and caging people with substance abuse problems, mental health issues, or too poor to afford a home. In that process, we made correctional facilities so overcrowded that we had to send people to the continent to be caged, and in the process made rehabilitation and reentry so much more difficult. And so that brings us to this moment in time where just last month, pretty much all correctional facilities were operating well above their operational capacities, and sometimes twice as much as their design capacities. And let me explain briefly what that means. So operational capacity is what the PSD determined is the safe number of people that they can have in their facilities. They are operating above that number. The design capacity is the number of people that the facility was designed to have in a comfortable way and without having 2 or 3 people in one cell. because we have so many experts on public health and corrections in this panel, I'm not going to go into the public health reasons why overcrowding during a pandemic is so dangerous. I guess a fourth misconception is that people are safe there, that people are safer in prison or jail. And as Dr. Yamada is going to explain, that's not the case. But at some level, you have to think it makes sense that people cannot practice social distance in prison. They don't have often access to warm water or soap. And of course, if you have 3 people to a cell with 1 person sleeping on the floor, social distancing is impossible. And so you have seen outbreaks already in the continent. In Rikers, for example, you had 287 people held there who contracted COVID-19, and you had 406 staffers who also tested positive, with 1 person dead yesterday. Similarly, in the federal prison in Oakdale, Louisiana, you had 138 prisoners who contracted COVID-19 and 59 staff members, with 5 people held in that facility dead. So instead of going through the public health reasons, I'm going to talk a little bit about the legal efforts underway here in Hawaii to keep people in jail and prisons, correctional staff, and our communities safer and healthy. There have been 2 petitions by the public defenders. And really, this is kudos to them. Not every public defender in the country has done this. And so the first petition was filed just 2 weeks ago on Monday, March 23rd, when they sent a letter to Chief Justice Rechtenwald asking for the suspension of certain short sentences until the end of the pandemic. Essentially, people sentenced to misdemeanors or probation with an initial jail term. And the court did something quite extraordinary, which was they treated that letter as a petition for mandamus and asked the Attorney General as well as the prosecutors to respond within a few days. The public defenders and prosecutors then started a mediation, and they have been negotiating since then. But it has been difficult, particularly on Oahu, where they haven't been able to reach any agreement, in great part because the prosecutors insist that people get tested because they're released. And as everyone knows, there are just not enough tests. And also that people have housing or safe housing when they are released. And as many of us know, there is not sufficient housing, and many people in jail and prison don't have anywhere else to go. Because the scope of the initial letter was so narrow, the public defenders drafted and filed a second petition on Thursday of that same week. This petition was addressed to the governor, the Department of Public Safety, and the paroling authority. The petition asked the court to use its extraordinary powers, including mandamus and superintendent powers over the courts, to appoint a special master to release the people that I mentioned during the beginning. It essentially raises 4 but related separate constitutional claims. The first one is an 8th Amendment claim asserting that imprisonment in overcrowded conditions that puts people's health at risk and also the risk of contracting COVID-19 constitutes cruel and unusual punishment. The second claim is a 14th Amendment claim asserting that the detention of people not convicted of a crime in an overcrowded environment that poses a significant health risk violates due process. The third claim is a second 14th Amendment claim, but this time asserting that for pretrial detainees, again, those are people who have not been found guilty of anything, but who are in jail during the pandemic because they cannot afford cash bail. That violates equal protection because wealthy people can and do get out, and also violates due process because lack of cash is not a good reason to detain them. Finally, a third 14th Amendment claim was asserted, and this is a due process claim on behalf of everyone in detention and those also incarcerated, asserting that the risk of health and loss of life were not considered during the sentencing or bail proceedings for their case. So different government actors filed different responses to the petitions. The main message seemed to be, however, we got this, let us deal with this among ourselves. The AG also argued that overcrowding alone was not unconstitutional. That being said, and to the credit of the AG, they did not oppose the appointment of a special master, and they did not underplay the urgency of the situation. We filed our amicus in the second case on Wednesday, April 1st, last week, together with Tom Helper at Lawyers for Equal Justice and Bob Merce, and also many others who helped. And the brief essentially makes 5 points. This pandemic requires immediate action by all actors involved. Overcrowding in the middle of a pandemic is indeed unconstitutional. It's not just overcrowding alone. The relief requested is consistent with what other courts all over the US are doing. The special master could conduct swift individualized review and order release. And finally, several of the conditions for release being proposed, such as testing for COVID-19 and housing, are irrational and unconstitutional. I'm almost done. So last Friday, the court appointed Judge Dan Foley to make recommendations to the court on how to address overcrowding, and he has to make that report by Thursday of this week. He has a very broad mandate, and we hope he will make strong recommendations that will result in the immediate release of many people. At this point, we're still working with the public defenders and other people such as Eric Seitz, who filed another amicus brief yesterday on behalf of public health experts and human rights experts. We should know more about what Judge Foley will recommend on Thursday. In terms of what you can do, I know Monica is going to talk that at the very end, but just to give you a preview, we need your help. So many people are writing right now to their public officials, to their representatives, saying they're concerned and scared, in part because of all the misconceptions that I addressed earlier. So we want you to call and write your elected officials, and also talk to your friends and family, and tell them that this is not about what many prosecutors and many other people are saying this is about. And so write to your council members, your prosecutors, your mayor, governor, and representatives, and tell them that you support the release of people on humanitarian grounds. Thank you.
Can you hear me? So we wanted to go ahead now and pass it over to the public health experts. The first person who's going to be talking is Dr. Seiji Yamada. Dr. Yamada is a professor in the University of Hawaii Department of Family Medicine and Community Health. He was born in Hiroshima. He grew up and received his medical training. Oh, sorry, let me try that again. I understand some people might not have caught that. So we're going to introduce the medical experts now. And the first one who's going to be talking with us is Dr. Seiji Yamada, a professor in the University of Hawaii Department of Family Medicine and Community Health. He was born in Hiroshima. He grew up in and received his medical training in Illinois and has practiced in Hawaii since 1994. Dr. Yamada, please go ahead. Thank you so much for joining us today.
Hi, I'm Seiji Yamada. As a caveat, I'd like to mention I have no experience in correctional medicine. I'm mostly interested in promoting health as a human right. I think some of this is very common sense when one is incarcerated in crowded conditions. There's a virtual impossibility of doing social or physical distancing. And we understand that there's poor access to hand washing facilities, and that in many prisons around the country that hand sanitizer, because of the alcohol content, is not allowed. Now, in terms of the risk of death from the coronavirus, obviously we all know by now that the elderly are at more risk, and of course those with other health conditions, including diabetes, hypertension, heart disease, lung disease, are going to be at more risk of death from contracting COVID-19. And an outbreak inside prison walls would be difficult, if not impossible, to control, and would undoubtedly contribute to transmission of the coronavirus in the general community, reminding us that we are all only as safe as the most vulnerable in our society. So I think we've seen that over the weekend. Dr. Anthony Fauci has said that up to 50% of individuals infected with the virus, the SARS coronavirus 2, the agent that causes COVID-19, are actually asymptomatic. And we know also, we have that from studies from China, that individuals are highly infectious before they develop symptoms, for like the 2 days before they develop symptoms, and peaking in their infectiousness right around the time that they develop symptoms. So this implies that even if visitors have been banned, as I understand they have been in many places, symptom screening of workers, including guards, into jails and prisons will not keep out the coronavirus from those facilities. So in his book, Pathologies of Power from 2003, Dr. Paul Farmer discusses tuberculosis as punishment in the context of multi-drug resistant TB in prisons in Siberia. And if we substitute what he has to say, substituting coronavirus for TB for our current situation, so quote, as long as prison serves as an amplifier, as long as effective treatment is not ensured, coronavirus is part of punishment. Farmer notes further that the US Supreme Court had in 1976 reminded us that, quote, deliberate indifference to the serious medical needs of prisoners constitutes the unnecessary and wanton infliction of pain proscribed by the Eighth Amendment. So while I happen to have a little time online with lawyers interested in civil liberties, I'd like to say that I'm also committed to civil liberties. I will note, however, that living inside the pandemic has me rethinking of the need for coercion by the state when necessary for public health ends. And so I had a piece in the Star Advertiser last week, Tuesday, I believe, in which I urged more testing. We need to do more testing because for one, up to half of people who have the virus are asymptomatic. So we just can't know who is infected with a virus without doing more testing, and testing of contacts of people who have been shown to carry the coronavirus. Testing of people with, a lot milder symptoms than the guidance from the CDC a few weeks ago said that we could only test people that are deathly ill in the ICU. Well, we need to test more widely in order to find out who they are. And we need to be able to isolate those people in a serious fashion. And when I say a serious fashion, I mean in their own room, with their own bathroom, and with food left outside the door by somebody on a tray, and with really no contact in order to protect others, including, in our community, the kupuna who many times share the household with us. So that sort of coercion, actually, I suppose, really sounds a bit like imprisonment. And I think that we're going to have to think a little bit about how we can utilize the power of the state for public health ends. So thanks very much for listening.
Thank you very much, Dr. Yamada. We appreciate your lending some of your time and expertise this morning. And speaking of which, now turning to Dr. Fox. Dr. Kealoha Fox is an Obama Foundation leader and a board member of the Asian and Pacific Islander American Health Forum. Her work at Aloha Care utilizes a social determinants of health model of care that values culturally effective public health and medical services. Dr. Fox, thank you so much for being with us today. Please, I'll go ahead and turn it over to you.
Thank you so much. I'm going to try to share my screen here. I wanted to provide some key messages. And there we go. So really, I wanted to discuss some important points around incarceration as a barrier to health equity. As Josh had mentioned, today is World Health Day and it's National Public Health Week, and it's bringing additional energy to all of us around the world, especially those of us in the Hawaiian Islands, those of us that are health professionals who stand for health equity and the role of racial justice in the well-being of our communities. I wanted to just first start by acknowledging all of the health professionals today: physicians, nurses, psychologists, epidemiologists, health attorneys, biomedical scientists, public health educators, social workers who are working tirelessly every single day for their families, in their workplaces, for our communities. I especially wanted to provide my respect to those that are currently sick with the coronavirus, and I want to provide my deep condolences to those who have lost their lives, both during the COVID-19 pandemic, but also those who have lost their lives due to incarceration. What we're talking about today is we're talking about real people. These are real lives, and we're talking about real solutions that can be enacted right now, not later. So I want to mahalo all of the staff and the leadership at the ACLU Hawaii and all of the ACLU advocates across the country working so hard for smart justice. It's really an honor to present alongside Drs. Yamada and Miscovich today for their insight and their contributions. So here are a few key messages that I feel like are really important today as World Health Day and National Public Health Week. First is that incarceration is a public health epidemic. It's a well-documented disparity, and that disparity is especially noted in the overrepresentation of Native Hawaiians and women in Hawaii's carceral systems. For us to address that, we have to bring an equity lens and analysis to prevention, testing, containment, and treatment, including all people for all groups. Exactly as Dr. Yamada just said, we need much more testing, and we also need to recognize that there is a large proportion of asymptomatic people. For us as health and medical professionals, we really guide the standards of our practice and our ethics around what is best practice, what's evidence-supported treatment, and what are the latest trends in our industry. So in the United States, when we talk about the recommendations and advisories coming out of the CDC, we're really talking about the same structure that houses Healthy People 2020. Those tenets under Healthy People 2020 say that everybody deserves high quality lives that they can lead free of preventable diseases, disability, injury, premature death, and that this is for all people, and that everyone has a right to good health across every stage. Healthy People 2020 also recognizes the social determinants of health, right? That health is not simply physical conditions, signs, and symptoms. Health is about economics. It's about education. It is exactly what Josh had said. It's about the health in our neighborhoods and the housing insecurity that we have. These are the social determinants of health that we have to think of in real time right now to protect Hawaii and to build the system of health and well-being that we really see in our own social and community context. But Hawaii is not alone. Healthy People 2020 doesn't happen in a vacuum. This is also the same message that is being promoted around the world through the United Nations Sustainable Development Goals. These were developed in 2015. They are targets for 2030. And exactly what we're talking about today, the intersection of health and well-being, peace and justice and incarceration, is strongly a part of the SDGs and Goal 16, where the UN, the WHO, many international and multilateral organizations are saying that sustainable development is really based on inclusivity, and that access to justice and in these criminal justice systems really have to be under this lens of scrutiny, transparency, good governance, and we have to have societies that are able to think about rehabilitation and reintegration back into society as a form of our overall wellness. I wanted to share some of the research provided by the Robert Wood Johnson Foundation, who's really one of the nation's leaders in health equity and racial justice. their work is really tremendous when we look at discrimination and incarceration, these triggers that are really vicious cycles, and they continue to threaten health equity. This is a principle that we really have to think about in the work that we're doing and the recommendations that we're sharing, right? That incarceration of an individual doesn't happen randomly. We have so much information on the causes and the associations that have to do with deep and entrenched racism over generations, discriminations, discriminatory policies, discriminatory systems that impact the arrest rates and the lack of effective treatments that are reasonable and culturally competent that bring about these cycles of mass incarceration, which many of us as public health officials, we really feel like incarceration is a public health epidemic. With this cycle, what we see is a dangerous pattern of health and mental health outcomes, not only for the individuals that are detainees in jails and prisons and detention centers, but for their families and the communities that they come from. This is very integrated when we think about those social determinants of health that I mentioned earlier. It's about addressing poverty. It's about addressing society and how do we come together really as a whole for whole people health and whole family health. I wanted to just talk a little bit about the overrepresentation of two groups. These are well-documented trends. They have long been published in academic, government, and legislative settings with nonprofits and experts across Hawaii. So the first subpopulation I wanted to bring to light is the over-incarceration of Native Hawaiians. So Native Hawaiians really make up about 18% of the adult population in Hawaii. We make up more than that if you add children and youth, but we are overrepresented as 37% of the incarcerated population. The trends and patterns that we have seen in doing this research and this data gathering and the monitoring of the over-incarceration of Native Hawaiians includes looking at those that are overrepresented as detainees, the issues around cash bail, sentencing, the over-sentencing of Native Hawaiian inmates, the release rates being much further out than their counterparts, and the terms and the conditions under the probation are not similar across the board when you look at their racial and ethnic peers. This is something that we're tracking not only for those that are incarcerated here in Hawaii, but the tremendous over-incarceration of Native Hawaiians that are sent to the US continent, and they are housed in facilities outside of our Hawaiian Islands, away from our homeland and away from their family and the community that represents a culture, a history, and a resilience for them. The other area I wanted to bring up was the subpopulation around women. Hawaii has the largest proportion of women in their prisons, especially Native Hawaiian women who make up a disproportionate number. In all of my research that I have done personally, and then I have also been able to learn from and gain knowledge from, all of these women have experienced high rates of trauma, abuse, and neglect as children, as adolescents, into young adulthood. That is a part of this pattern and the social determinants that are incarcerating women at much higher rates now. I wanted to bring back that quote from the beginning. This is from the National Academy of Sciences, from a brand new publication that they just released. The National Academies are really one of those premier institutions like the UN, like the WHO, that we as scientists and public health professionals, we rely on, that the criminal justice system is a driver of health inequity and it's impacting the well-being of our communities around the country. Since the 1970s, there has been countless organizations in Hawaii that are trying to address this. Community leaders like Dr. Miller, who is on with us today, like Dr. Radine Kealoha, Dr. Kamana Opono Crab, Justices Wilson, Justices Broderick, Merce. You know, what we're talking about is leaders that have stood up for many years now, and they're calling for an end to this incarceration epidemic in Hawaii. So I just really want to mahalo nui them and their tireless work for racial justice and health equity. There are a couple of key messages that I wanted to just close with. This message is not new to us. This is 150 years of Hawaii's history. And what we're talking about today with the ACLU as public health leaders in medicine, in health, and science is what are we going to do today to protect the frontline workers so that we're not overtaxing the system, so that we're protecting those that are incarcerated, and we're also protecting those that work in these detention centers, these jails, and these prisons as well. We're talking about protecting the entire system and those that make up the whole community. I wanted to just end briefly with this concept. So one of my kupuna, my ancestor, was an editor for the Hawaiian language newspapers, and he wrote in Kaleo o Kalahui about the spreading of a sickness. And he referred to it as ma'i ho'oka'awale ohana. It's this disease that separates our family. This is 1865, my kupuna, Kahikina Kelikona, is writing about this. And at the time, what he's talking about is Hansen's disease, which was then called leprosy. He refers to it in his writings as something that was so traumatic, not just for the disease progression itself, but that separation of families being put into this colony on the island of Molokai that separated them from their home island, from their ohana, from their family, and from those relationships that brought those social bonds. Fast forward until 1983, we have tremendous amount of documented reports and session laws and concurrent resolutions that talk about this ma'ipa'ahau, this epidemic of incarceration and mass incarceration. Imprisonment has been noted in the Native Hawaiian Study Commission, in the Native Hawaiian Criminal Justice Task Force, the Hawaii Criminal Pretrial Reform work. Over and over and over again for many years, we have talking about ideas for solution and recommendation. And here we are now. We are in 2020 and we are experiencing this ma'iluku, this COVID-19, and it's an epidemic. And this is a genealogy of over 150 years of what we're trying to untangle. These are not separate from one another. This history has to do with the social determinants. How do we address mass incarceration today? How do we talk about it within the sphere of COVID-19 and protecting those that are currently incarcerated? But how do we also talk about building a public health system once we come out of this pandemic, that we look towards the future that is really framed and based on the values and the principles and tenets of our kupuna, of our communities, that are grounded and guided in our true values of ohana and kokua and malama for the community that wants to see health equity be that primary driver. So I just wanted to thank ACLU for allowing me to speak. Thank you.
Thank you very much, Dr. Fox, for your work, and thanks for the kind words about the work that ACLU is doing. We appreciate it. Next up, we have Dr. Scott Miscovich. Dr. Miscovich is the president and founder of Premier Medical Group Hawaii. He's one of the founders of the Hawaii Homeless Healthcare Hui, otherwise known as H4, and he's been leading efforts to expand testing for COVID-19 in Hawaii. As a matter of fact, he is joining us today as we speak from running screenings on the island of Molokai. Dr. Miscovich, thanks for everything you're doing, and I'll turn it over to you.
Thanks, Josh. Can you hear me okay? Hello?
Yes, I can hear you.
Okay. Just wanted to make sure I could be heard, because I am coming to everyone live from Molokai, and over my shoulder, I think it's appropriate after Dr. Fox's eloquent discussion to really just see where we are and to see what's going on. And I want to just give everybody an update that it is going fabulous. The greeting and the response from the people of Molokai is so wonderful. And we're going to be here the next two Tuesdays for sure, if not longer. So I've been asked to discuss, since I'm leading the team that's on the front lines, to talk about talk about this crisis, talk about how this is transmitted, talk about where we stand right now. In the state concerning the progress or lack of progress that we're making, and how does this tie into the efforts of the ACLU and the discussion with our prison population in the state. So first, I want to say that the majority of all health professionals, with the exception, I believe, of the Department of Health in the state, are believing that the way we solve this, get to the bottom of it, flatten that proverbial curve, is by testing, testing, and testing. And after you test, you then must find the positive individuals. You must isolate them as quickly as possible. You must track their transmissions, socially isolate everyone, and basically repeat and repeat and repeat. So that is what we're trying to do through the state. Our group right now is probably tested about 40% of everyone in the state, and I'm certain we're probably going to be over half before the end of this weekend. So what does this mean for the populations? What are the risk populations? Well, we all have the luxury, if you're living in a home, that you can try to socially isolate, but a prison population has no chance. The situation, we all know our prisons are overcrowded. We all know the environment with which the prisoners are there, and it doesn't work. It is the crisis of COVID waiting to happen, in my professional opinion. On the other hand, I also have many of the prison guards that come to me as patients, and they are very, very concerned. They don't have PPE. And so in general, the whole system is one of the last bastions of where we can actually shut our Queen's ICU down, or our hospitals down, or our intensive cares, if we don't all boldly step up and find a way to do what's right. Now, when you talk about what the CDC guidelines are, the CDC guideline basically says that a minimum, when you're talking about a group housing situation, there should be 12 by 12. I was fortunate just yesterday, I went through World Health Organization training on safety in group environments in the era of COVID-19. And they're even talking about, you know, the barriers and the type of ventilation. All of those things are very crucial. And preparing for this talk, it was very clear to me that I don't believe any of our prisons are set up where they're adequately going to address safely the concerns that the top experts throughout the world are saying we need to address in a population such as this. So we have to take bold action. The bold action is we need separation, we need the proper ventilation, we need infection control specialists to be able to talk about how you look at possibly the individuals that are remaining, how they can be socially and safely separated, both with meals, with bathrooms, with showers, with every aspect of ways that we know this disease can be transmitted. Now I'm going to bring out another situation that is mostly keeping us professionals up at night. We now know through very well done data, and this has been the case, and we've been pushing it to, as the top experts in the state are gathering together, 20% or more, and it can be up to 40% of everyone who contracts this disease may be asymptomatic. And take that into a prison population. We may have a prison guard who has a family at home that may just have a child with a runny nose. Little do they know that may be the way it presents in children, which is very mild. They may be carrying it back in, not knowing. They may remain asymptomatic, and this disease could spread before we know it, because we also know the new data shows that 2 to 3 days before you manifest any type of symptoms, whether it's respiratory, upper respiratory, sore throat, loss of taste or smell, or cough, you can be shedding it. So in a closed environment where we're not paying attention to these other areas where this disease can be spread, we may be just waking up one day and find this basically spreading throughout any of the prisons in our state. So from my perspective, the other thing I can tell you is everything we're hearing right now in our state from the Department of Health isn't up to date with what the front lines and what the lead countries are talking about with this disease. They're dealing with things from January and not up to date. To understand that there are so many subtleties of the way this disease presents that unless you have extraordinarily trained clinicians, it's going to be impossible to be identifying the all the carriers. And if we could get to absolute treatment absolute screening of every individual, then that would be about the only place we could go. So from my perspective, being on the front lines, having had at least 25, probably 30% of all the positive cases in the state are managed by myself and our group. And it's maybe even higher because just this morning I've had another 5 called in. Yesterday I had 7 called to me. Every day it's 5 or 10 we're getting called in through our group. We need to do something, and I'm open to talk more or answer any questions as I literally come from the front lines from all of these heroes that are behind me here that are out there selflessly giving of themselves and their time to help the people of Hawaii.
Thank you very much, Dr. Miscovich, and thanks for the time you're taking out on Molokai with your team today. We really appreciate it. The next panelist that we have up is Dr. Jamee Māhealani Miller. Dr. Miller is the co-founder of ACLU of a new organization committed to justice reform in Hawaii. 10 years ago, Dr. Miller's son was the driver of an accident that took the life of his friend. He was 19 years old, then in college. This was his very first encounter with the law. He pled guilty and was sentenced to the maximum of 10 years. And to this day, that is the harshest sentence in the history of Hawaii for similar circumstances. He continues to serve his sentence in Saguaro Correctional Facility in Arizona. He is deemed a model inmate and yet has been denied parole several times. Dr. Miller and her family have experienced extreme disappointment at every point of convergence with the Department of Public Safety. ACLU Mea is a response with the hope that no ohana needs to go through the unnecessary worry and pain when involved with incarceration. Dr. Miller, thanks for being so generous of sharing your story with us and your expertise, and I'll turn it over to you.
Aloha, everyone. Mahalo, ACLU, and the previous speakers for bringing the human piece into this discussion. And I think that's what has been missing throughout the last several weeks with this epidemic, but it also for generations, as we learned through the history of incarceration and illness touched on by Dr. Fox. So yes, 10 years ago, we had a tragic event that we wish upon no other person, no one involved, everyone involved, I should say, had pain and hurt and sorrow through all of this till this day. And for us, it was, we felt like it was the right thing for our son to plead guilty, and we depended on the justice system, our very with the justice system, to fairly, for him to go through this fairly, and actually it is the opposite that we have experienced. Every single data point that Dr. Fox alluded to and others around the over-incarceration of Native Hawaiians, my son hit. And as we continue as an ohana to support him on this journey, we have been disappointed left and right. And so right now, what that means for us, he's in Arizona at Saguaro Correctional Facility. I haven't heard from him in 2 weeks. He usually calls us about once every 3 days, and always on Fridays. We haven't heard from him in about 2 weeks. And he warned us, the last time I spoke to him, he said, Mom, I think they're gonna keep us in lockdown, and you may not hear from me, but I'm safe, I'm good, I just don't want to catch this virus. He's in a pod with about 150 other inmates, and there were 15 of them that were removed a few days before the time that I spoke to him. And he said that they had symptoms and they were being isolated and in quarantine. but he didn't know if they were tested or if they were even positive, but they were just removed because they had some symptoms. And so, you know, I just said, well, take care. You know, I was trying to give him all the stats that we know out here around where the virus could survive on steel, et cetera, on clothing. So to do his best. And I asked him if there was anything that all of them were being provided to be health conscious or safe, specifically around antibacterial soaps, etc. He said they weren't getting anything more than what they usually get. And he said the instructions that they were given was to keep washing your hands. And so he, you know, we give him money every month, and he does work there. He doesn't get paid a lot, but he uses that in the commissary to purchase extra soap and things. He did say that he thought that would be probably shut down if they go on lockdown. So he wanted to put in as big of an order as he could. And so I'm just really terrified, you know, that it could spread within there, and that they don't have, I'm not sure if Hawaii is keeping a pulse on these private prisons and what their protocols are. I tried to inquire, I haven't heard anything back yet. And I tread very lightly around that because I am fearful that there will be some type of retaliation given that my son is still in prison. And so it's been really tough trying to figure out what can we do and what can't we do, what can we advocate for, what should we be quiet about. So right now, I know he told me the last time I spoke to him, he said that there were 2 people in their county that had died, 2 confirmed deaths. I did look at the stats very quickly in Arizona, and they have currently about 2,700 plus positive cases of the virus with 80 plus confirmed deaths. And I know that where the prison is located, they provide jobs for 3 counties in that area. And one of the counties is number 2 for the highest number of confirmed cases, and the second highest number for deaths in Arizona. When we visited him 2 times ago, they were expanding the facility. So during that time, there were about an 1,897 bed facility, and there were 1,500 or so Hawaiians that were being housed there, and only from the state of Hawaii. This last time we went in January, in February, beginning February, they expanded, and they were receiving inmates from different states. I know they were receiving from New Mexico, from New York, from Texas, from Kansas, and they were all sharing space there, and it continues to be like that since 2 weeks ago when I spoke to him, that there were still inmates coming in and out in masses, like 150 or more, whatever can fit on a plane. And so I'm really concerned because we're not informed of the protocol. I haven't heard anybody speak about it, our government officials. He has asthma. And so it's pretty scary for us. Which is why we created ACLU Nui, which is an organization to help transform the justice system here in Hawaii. We're brand new, like the introduction said, and we are partnering with a national organization called Cut 50. And one of their programs, and they've been moving the bipartisan movement across the nation around justice reform state by state. And one of the programs that they have is called Reform, and they have put out a set of common sense recommendations that would make everybody safer. And they use that as an acronym, SAFER. And some states have adopted it. And the federal level prisons have also adopted it. And it's similar to what we're recommending here in the state, but it expands beyond that. For instance, it's free healthcare for inmates if they start feeling it, some of the symptoms come on. It's releasing the vulnerable and the elderly, extra precautions for correctional officers and staff. And so I know California, Kansas, let's see, there are 4 states that are making great movement in this area. And it's California, Ohio, Kentucky, and New Jersey. And so we would like Hawaii to be one of those, and hope through all of this education, we can help move it that way, towards that way, and know what ACLU is doing to move this along as well. Ekolumia Nui is definitely would like to be a part of that. So if there's any questions, I am really, really worried about our own prisons, and it was stated earlier about not having the necessary safety gear for the correctional officers and other facility workers that go in and out.
Okay.
Okay, thank you very much, Dr. Miller. That was incredibly powerful. I appreciate you sharing that, and looking forward to working with you. I think we wanted to kick it over to Monica to have a couple of words and a bit of a call to action before then we're going to go into a Q&A. We have been getting some Q&A showing up in our Q&A box. Once we start that, Katie Chavez, our development director, has been good enough to manage this behind the scenes and also to agree to kind of moderate the Q&A for us. So Monica, do you want to go ahead and get into your call to action and some closing words from you before we start the Q&A? Oh, can't hear you.
Can you hear me now?
Yes.
Okay, it says I'm muted by host, but okay. I think that first I just want to thank all of our panelists for giving us so much great information. Dr. Yamada, Dr. Fox, Dr. Miscovich, Dr. Miller, for taking the time out of their busy days to go over with us the importance of being guided by sound medical facts. We need to help our people inside, and they are our people because they're our loved ones, our community. Releasing our families and friends from incarceration, including those who are elderly, medically vulnerable, or are incarcerated because of an inability to afford cash bail, is the right thing to do, and it's the medically necessary thing to do, as we've heard from all of our panelists. Jamie talked about this, that in Arizona, there are over 1,000 men right now at the Saguaro facility. That's people that are far away. And Dr. Fox highlighted the groups that are being disproportionately affected by this. We know that in our facilities, 47% of incarcerated people are Native Hawaiian and Pacifica, though they only make up 23% of the population. So what is it that we want you to do? What is it that we're asking you to do? Because the lift is very heavy. There's a lot of misinformation out there. Mateo tried to address some of it. But we know that a COVID-19 outbreak in our prisons and jails will mean overlighting our hospitals. So it'll mean a great physical danger to the people that are incarcerated, to the people that are working, but also to the communities on the outside. So what we're asking you to do is to join our social media campaign, hashtag #FreeOurOhana. Use that hashtag on your social media. If you're interested, I can send you the social media kit to you so you can have access to all the images. If you RSVP through People Power, I'll send it through there. We also are asking you that you please send our open letter from people with loved ones incarcerated. We'll be sharing that publicly tomorrow. And I will email it to all of those who RSVP'd on People Power. We need you to write letters to the editor and tell them your story. Tell them why this is important. If you have firsthand knowledge of the conditions inside, I need you to contact the Department of Health, the governor, the prosecutors, the press. They need to hear these stories. It's important that we talk about it as the ACLU, the doctors talk about it, but if you have a personal story, that you please share that with everybody. So it becomes, so we can uplift these voices that are so, so powerful. And from that, I will finish my piece. And I just want to thank again so much for all the panelists that joined us today, and for sharing your time and yourselves. Thank you.
Aloha, can everybody hear me? Great, so this is Katie Chavez. I am our development director, but I'm going to be facilitating the Q&A session of this webinar. So for panelists, please be prepared to unmute yourselves as questions come up. It looks like our first question in our Q&A box is from Thaddeus, and the question is, will you folks share template language to contact legislators and stakeholders?
I think that would be for me. Can you hear me? Okay. Yes, we will definitely be sharing that. We will send that out in the email. And if you are, like I said, if you RSVP through People Power, I'll send that out through there.
Great, thank you, Monica. Next question is from Kevin, and it is for Mateo. Mateo mentioned that one of the legal arguments is that you cannot require proof of housing in order to release, but as a practical matter, how do we address concerns of community-based orgs and shelters, which are already full to where folks will go if they are released without housing?
No, that's a great question. And I think I want to separate here the legal issue from the practical one. And essentially the legal issue is that we think it's unconstitutional to require housing because essentially that is another form of wealth-based detention. Essentially, you're denying someone release at a time of crisis because they cannot afford a place to be. And as we all know, our shelters are full. You know, it's very difficult to find affordable housing here. You know, but I understand that ideally, and I think this is in everyone's best interest, we would have reentry plans in place. We would have housing for people. And I think those concerns are absolutely legitimate. I don't mean to subtract those, you know, or deny those concerns. However, I will say we are in a crisis, and housing, as I said earlier, should not be a legal barrier. And I guess the last thing I'll say is that people in Hawaii have been released from jails and prisons now for decades, where they didn't have a reentry plan, where they didn't have a place to go. And so I just, again, personally find it a little bit disingenuous when it's the prosecutors and the Department of Public Safety who all of a sudden they really care about whether people will get housing or not, when for decades they have been fine with just releasing people without reentry plans. So I think it is a concern, and I know a number of people, Bob Merce, Monica, there are a number of people out there working on reentry and trying to make that transition smooth. And it's a difficult one, a difficult issue to tackle, but again, I don't think it should be a legal barrier.
Thank you, Mateo. Okay, next question is from Heather, and the question is, how can we work with city/state and HTA/HLTA to utilize hotels for those who are houseless and are coming out of incarceration, like some areas on the continent?
Right there. Hi, can you hear me? Okay, so I can speak to this a little bit. We have been talking, ACLU has been talking a bit to some of our colleagues in other jurisdictions where this has been happening, where there are hotels that, for the obvious reasons, don't currently really have many guests that have been making space available for people who are unsheltered. It has the dual benefit of both giving shelter to people where they can also self-isolate, practice social distancing, and have access to proper hygiene, while also giving people who work at the hotels the ability to keep working at their jobs because they have people who are now guests of the hotel. I know that there are some people at relatively high levels of state government who have actually approached HTA and some of the other organizations to see if they can go ahead and open up their hotels for those purposes. I think some of those conversations are still ongoing. And I think for anybody who's listening who agrees that it's a good idea and something that would help keep people safe, to go ahead and contact HTA, go ahead and contact your representatives, your elected officials, and ask them to contact HTA and put this forward as a compassionate and at this point, medically wise move to make to try to help these folks.
Okay, and for the panelists, you should be able to unmute too if you do want to add on to that question. Okay, on to our next question. This next question is for public health experts from Civil Beat. And the question is, as you know, public safety has released a pandemic response plan and said it would be isolating inmates suspected of having contracted COVID-19 or have tested positive for the virus. With the confines of the correctional system, what could be the ideal conditions under an inmate could be isolated for treatment? What sort of accommodations, including access to the outside, would be needed?
If I may address that, I said in my earlier remarks that the requirement really would be that a isolated person have his or her own room, his or her own bathroom, and really no contact with others while receiving, say, food or while in transit to go outside. Obviously, also good hand washing facilities, as well as, of course, wearing a mask in order to try to prevent transmission to others. So rather resource intensive requirements would be needed. I think if you're in a hospital setting, then you actually would have negative pressure, meaning that no air leaks outside of that closed door. Beyond those closed doors, there would be like double closed doors, and that air would actually be vented to the outside rather than to the hallway. Now that's kind of what happens in a hospital. I can't imagine that that can be accomplished in many other environments other than inside of a hospital.
Thank you. On to our next question. Our next question is from the Star Advertiser, and the question is, could I just ask the entire panel, please, what specific concerns they have been hearing from those incarcerated, as well as the ACOs and other employees, and what specific recommendations they have?
So I'll share some secondhand things we have heard, mostly through the public defender's office. So this is not things we are hearing firsthand. But obviously, for now, 2 weeks or more, visitation has been suspended at all the facilities here in Hawaii. And so it makes it much more difficult to keep in touch with loved ones and to get information out. The Department of Public Safety claims they're making it easier to talk on the phone. But as you would imagine, as they cut off visitation and everyone wants to use the phone, I think it makes it more difficult to actually get information out. So we are hearing that, there are people in jail are concerned. They don't have very often adequate, they don't feel protected in prisons and jails, and that, for example, they still have to purchase their own soap. They don't have access to alcohol-based hand sanitizer, things like that. It's still overcrowding, even though it has been going down based on the numbers lately released. It's still very much is happening on a daily basis, where you still have 2 or 3 people to a cell. And of course, people are just very anxious and concerned. And as you would imagine, with very little they can do from the inside to protect themselves. So that's essentially what we have been hearing for the most part from the public defenders when they do talk to their clients. And that's the reason why the public defenders filed that petition 2 weeks ago, was precisely because they had those concerns, and they felt that both the Department of Public Safety and the state of Hawaii wasn't doing enough, and they were not taking these issues seriously enough. And so that's why they filed the petition.
And if I can add, sorry, to what Mateo just said, we've been hearing similar reports from people. There's not enough hand sanitizer when they're eating. It's still a big crowd. That they don't have enough masks. Even the conditions of the quarantine are not great if they're even being quarantined. I've had a mother call me from Maui saying that they're still bringing people inside, that they're not separated. So we don't know if they're bringing people inside that are already sick. I think the hand sanitizer issue is big. I think I already said that, but I keep hearing that over and over again. So it's pretty dire consequences and dire circumstances. And also when we hear of family members, and these are people that have their loved ones inside and they can't get answers. There's no way for them to help. And so we really appreciate you jumping on the call.
Thanks, Monica and Josh. Does anyone else want to add anything? Dr. Kealoha?
Yeah, I just wanted to add that I think it's really important that we bring up the research and the statistics that we currently know around underlying causes and the early stage case fatality rates. So there is a tremendous amount of research that's already been done to show that cardiovascular disease, diabetes, COPD, asthma, hypertension, and cancer has been documented in these early stage case fatality rates. This research has already been done by other countries. Those chronic conditions, so we're talking about a communicable disease, those chronic conditions are incredibly important for us to understand within the incarcerated population, because they already have high rates of all of those conditions that I just listed. That's very well documented by the New England Journal of Medicine, by the Lancet, by the National Academies of Medicine and Science. I mean, the connection between chronic health problems inside these jails and prisons is something that we have to address in that connection point in prevention at the same time, right? And I think there seems to be a need to continue to go back what Dr. Yamada and Dr. Miscovich already said in the high proportion of asymptomatic people, right? So we just have to make a couple more of those connections, I think, really clear with the statements that they're putting out and the totality of the public health and medical picture that is really at stake.
I wanted to share that not only the physical well-being of the inmates are concerning for us, with my son being 5,000 miles away and we get to talk to him once a week. That was very grounding for him. And it was keeping him, in touch with his ohana, which we know is really important to us who born and raised and live here, and others. Being in touch with your family is that's your lifeline, that's your support. And so even the conditions of their mental health is very concerning, and things that that worries me, and I know worries others. I've also heard from I'm a social worker too, and so I've also heard from other moms that they're worried about a particular facility here in Hawaii. The same things that we've already heard about, the hand washing, not enough sanitizing, etc. And and that they have brought it up with administration. And this is coming from the ACO side, and they're basically doing nothing. So I reached out to that prison and spoke to the warden, and he's particularly interested in getting help. He said he put orders in for masks and hand sanitizers, and but it's on hold right now. It's going to take a long time to get to him, but in the meantime, he would like anything and everything that could help them. And so and so I think that, you know, especially when you're talking about a well-being and the holistic approach to justice reform, that we have to also look at the underlying pieces that could also add on to the physical well-being, but also the spiritual and you know, taking care of their mental health.
And if I may add just quickly, I absolutely agree with Dr. Māhealani Miller. And on that same front, what we have heard, not necessarily from people in jail and prison, but actually from the Department of Public Safety about their own plans on how they are responding to this, is very concerning, particularly when it comes to making conditions that are already bad worse. So essentially, most of and you can read it, it's online, but most of the measures that the department is taking is about taking benefits and privileges and rights away from people in jail and prison. As I said, they began with visitation, and we understand some of those things might be necessary for health reasons, but nonetheless, making the lives of people in jail and prison more difficult when they were already in bad circumstances and in bad shape does pose a great health risk and make, you know, for example, people who are at high risk of contracting COVID-19, the Department's public safety recommendation is to isolate them, to essentially quarantine them indefinitely. And as I think many of people here know, you know, isolation in you know, for international human rights perspective is a form of torture, particularly for a prolonged period of time. And so it is clear that the department's response so far, instead of providing additional soap, masks, testing, you know, hand sanitizer, has been to take away privileges, take away, you know, things like furlough, visitation, you know, the ability to get out. And those things will only get worse as, you know, many of our facilities were already understaffed. They do not have enough correctional officers. And so as correctional officers start getting sick, it's going to be more difficult to let people out. It's going to become more difficult to monitor everyone. And so that's another reason why it's so urgent to start releasing people, so that, you know, even at current staff levels, they are able to manage a crisis if and when anything happens.
Thank you. Okay, our next question is from Jennifer. So they say, aloha all, and thank you so much for all of the amazing information. Almost all of my clients are in SCC as well, and information has been difficult to get, but much of what I have heard was echoed by Dr. Miller. Since information is not being provided by DPS, is there currently in place a way for those clients and loved ones in SCC to share any info as they receive it?
Yeah, that's a great question, and something I've been trying to find out and contact DPS about, and I haven't heard anything back yet.
Okay, and our final question is from Maile, and it is, where is Governor Ige on the issue?
I can take a shot at answering that. So, of course, we would urge people to contact the governor's office himself and ask where he is on the issue, but I can tell you some of the comments that he's made recently. One of these was in the context of the governor asking for space at the Federal Detention Center to transfer inmates from state jails and prisons over there. And I think one of the things that was telling about that, and I'm actually quoting from the Star Advertiser article right now, that Governor Ige had said, and I quote, "A reduction of the inmate population density decreases the chance of COVID outbreaks among inmates and corrections staff and is therefore a critical measure." So what's interesting about that to me is that the governor does seem to fully acknowledge that it is, in his words, critical that we decrease the population in the jails and prisons. The problem with this approach, however, is twofold. One is he's doing it in the context of just asking to transfer people from one jail to another jail. And I believe the states even said that from what they understand, the Federal Detention Center might not let these folks in anyway. So he's saying it's critical. He's acknowledging it's necessary to avoid a COVID outbreak, but he's not taking action on authority that he actually has as governor to actively reduce that population. He has within his power to exercise the power of things like commutations and pardons, especially for people who don't have much time left on their sentence, especially for kapuna, especially for people who are in bad medical shape. He could do that with the snap of his fingers. He doesn't just have to transfer people to the Federal Detention Center. And also, there are other people who've worked on this. The same Star Advertiser article quotes Carrie Ann Schroeder, noting, again, that jails, prisons, and detention centers, by their very design and nature, are the worst places to be in a life-threatening pandemic. So the governor is admitting that this is critical to avoid an outbreak, but his solution isn't really a solution. It's just to shift them from one place that's the worst place to ride out a pandemic to another place that's pretty much in the same situation. The one other thing I'd just like to take a minute to note is we also do have to pay attention to not only getting people released who are in all the categories that Mateo had mentioned earlier, people who are pre-trial, who don't have much time left on their sentence, who are kapuna, but also not putting more people into the system who really don't need to be there. I have heard of stories of the booking cells at HPD right now being wildly overcrowded, having people who are way too many people in a cell, more people than are designed to be in cell block at any given time, who don't have access to soap at all while they're there and it's overcrowded. I've heard stories of people being put in cell block because they were picked up for not having a registration on their bicycle. And having that kind of a person put into cell block right now is just creating a bigger public health risk.
One quick thing to add to what Josh said about governors taking action. You know, I know governors across the nation are in fact taking action, and they are commuting sentences. Just as an example, in Kentucky, Governor Andy Beshear is commuting 770 cases. In fact, and they have commuted nearly 1,000 of people who were about to be released. So action is possible, is being taken across the nation. And it's important that we keep up the pressure on our public officials. And this is a situation where the right thing to do will make us all safer.
And if I can just add on to that, to state the obvious, if they can do it in Kentucky, we darn well ought to be able to do it here in Hawaii.
Yeah, I can add on. Ohio, the governor has sent 167 names to the parole board for release. California, 3,500 inmates will be released by the direction of the governor. And in New Jersey, the Chief Justice has ordered the release of up to 1,000 individuals back to their community. The other thing that worries me here in Hawaii is that the parole board has canceled or postponed, whatever you want to say, all of the future meetings with inmates, and everything is just being put on hold. And so it's causing backup within. And then, like you mentioned earlier, you know, there's more arrests being happening, and so the jails are getting overrun. So it's like it's just bottlenecking everything even worse than it was. So someone had said, making a worse situation even worse. And so that is also worrisome, that the parole board has stopped meeting and our courts are closed, and yet we continue to incarcerate more and more.
And just one last thing I'd just like to add on that, circling back to something I said at the very beginning, where we could use help from everybody who is listening to this, which is that the messaging coming from the folks who are opposing any kind of meaningful releases is this messaging that we're talking about just opening up the doors and letting everybody out, which is a scare tactic and one that's just simply not true. We're talking about letting people out, again, people who are pretrial, haven't been convicted of anything. The only reason they're there is they don't have enough money to afford bail. They're basically being held because they're poor. Talking about releasing people who are kapuna, talking about releasing people who have just a month or two left on their sentences. These are folks who are going to be coming back into the community at some time soon anyway. And so pushing back on these kind of false narratives is going to be important. And also to remind folks that this is to protect the health of the greater community, because if there's an outbreak in these jails, it's not going to stay in the jails.
Thank you. Oh, we have one other question that came in from Ben, and it is for Dr. Fox. Are your slides going to be available?
Thanks, Ben. I'm glad that you found the slides useful. I would like to work with the ACLU Hawaii with some of the materials that they're putting together, especially around changing the narrative, because I think exactly what Mateo, Josh, and Monica had just shared needs to be put with the slides so that it's taken in full context, because I absolutely think those specific populations and individuals that Josh had just listed out are really critical to that whole picture. So yes, I'd be happy to work with the ACLU on that.
Okay, and Ben says mahalo, Dr. Fox, just FYI. So to close off our question and answer session, if just closing thoughts from all of our panelists, feel free to go in any order. I think Monica is going to close it out, but go ahead.
If I may, this is Seiji Yamada. Want to say that I think we've made this point, but this is a very stealthy virus, and while young people and healthy people might not have any symptoms at all, they can always carry it home to their elderly parents and other relatives, and that sort of thing can happen inside the jail too, jails and prisons too. We know from studies done in China that the home was the greatest source of infection. Infections happen among family members within the home, and so any sort of conjugate living situation, as exemplified by cruise ships, by aircraft carriers, and certainly jails and prisons, as we've already seen in the disasters happening in places like Cook County jails or Rikers Island have shown us. We need to work hard to try to prevent that. Thank you.
Anybody else want to say closing comments? Okay.
I just want to say a really quick thank you, of course, to all the doctors who took time out of their schedules today, including Dr. Miscovich, who had to jump off because they were going back to screenings on Molokai. So just our sincere appreciation for how incredibly generous you've all been with your time, as well as the folks on our own ACLU of Hawaii staff, Mateo for the work he and the legal team have been doing, Monica for all the work on smart justice, and for really having the idea to do this webinar and being the spark to make it happen, and for Kathleen and KD who have done so much work to make sure that this actually ran smoothly. It is our first try doing something like this with this tech, and it would not have been possible without this team. So just a sincere mahalo to everybody who made this happen and who were so generous with their time today. And for everybody who is still with us an hour and a half in and still listening. Thank you very much for caring about this.
Thanks, everybody. I think everybody has shared a lot of information. And I hope, my biggest hope is that we take this information and we share it with others, whether it's with the media, with your representatives, with the governor. I think it's important to counter the messages, all the misinformation that is out there, which is why we did this webinar. It's really, really important that if you see something or you hear something that is not right, that you come back, you know, with facts. Again, I'm going to send you all a link to our free Ohana toolkit so you can get involved on social media. That's something that's easy, that you can just share the images. We'll give you the script to contact your representatives, your legislators. The open letter that please, 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 we need you to sign, especially if you know of anybody who's incarcerated or you've been incarcerated yourself. Your voices are the most important and we want them to be heard. And write your letters to the editor, to all your representatives, and just thank you, and we'll be in touch. I'm going to email every single one of you, and you will have my email, and we will continue to be in contact, and thank you for joining this fight. Mahalo.